Hey everyone, welcome to PT Plain and Simple. I'm Sam, and today we are talking about neck tension, mid-back pain, muscle knots, muscle guarding, trigger points, whatever it is that is restricting motion and causing you discomfort throughout the day. Now, this particular video is dedicated to my buddy Nick, who reached out to me and let me know that this is exactly what he's feeling. Now, in his words, it's mostly uncomfortable with turning away, looking up, and I'm sure there's a lot of other things that I could be there to provoke these, but in general, whatever it is in this region tends to be caused by the same things. And I'll tell you, it's posture. So how you're standing, if your shoulders are back and down, everything up here is relaxed. If you're forward and hunched, it's on guard. So that's one. Two is muscle imbalance. So really tight pectorals, really weak scapular muscles that will cause that same posture. But what I want to talk about is what can we do to get rid of it. So I'll go through the exercises. We'll break down active range of motion, passive stretching, mobility, and strengthening in its most simple forms, because again, I don't want to give you a lot of things to do. I just want to give you the things that work and tell you to do a lot of them. But before we even get into that, posture is everything. So standing posture, shoulders should be back. The acromion should be level with the back of your ear. Just to give you an idea, you could have somebody look at you in the mirror. You could have a line coming down from the ceiling just to really tell. Your chin should be back enough that it's creating that same vertical plane. And that comes true with everything else you're doing, whether you're driving a car, sit close enough to the steering wheel, whether you're working at a desk. Elbows should be by your side, wrists slightly below your elbows, and your shoulders should be back and comfortable. Your monitor, top of it should be level with your eyes so you're not looking down or looking up too much. And ultimately, you should be in the same shoulder relaxed position everything you do throughout the day, barring reaching and grabbing and those small movements that don't last forever. But those static postures you're in, shoulders should be back and down. All right, so I am out by the pool, not just because it happened to be where I was when Nick let me know that he was having discomfort, but also just to show you that, again, you don't need anything fancy in order to accomplish these movements and skills. You could be anywhere, by the pool, in the gym, in your bedroom. Really all you need is some sort of wall or structure where you can do the next movement and floor space to do the other movements I'll go through. Now, the first thing I want to talk about is active range of motion. Before you get started on passive stretching, before you get started on strengthening, we want to get blood flow to the area, and we want to start moving it through its range that it's capable of in the moment before we do anything too aggressive to it. So first thing I'm going to have you do is chin tucks. They look a little goofy, but bringing your chin straight back like you're making a double chin, going forward, and just continuing to do that. Now what we're doing here is stretching out the suboccipital muscles every time we go back, which are causing the problem. Again, people with that forward head posture, these are very tight, these are very weak. So doing repeats of the chin tuck will help a lot with that. I usually like to do it actually against a wall where I can have that reminder of back, head, all in line with the wall, and then I push my chin back to improve on that cervical curve. Now, once we've done that warm up, we could also add in a little bit of rotation to your comfort level. The goal of this active range is not to provoke pain, but to increase blood flow, which creates relaxation and decreases pain. So don't fire things up just because you know that it's something good. Find the range that is comfortable and stop there. Now, let's move into muscle release. So, like I mentioned, trigger points, muscle guarding, muscle knots, whatever it is, it's usually because you have some sort of nerve that's not getting blood flow. Blood flow is chemical mediators, it's nutrients, it's oxygen, and without that, it's going to get pissed off. Now, when it gets pissed off, it just binds up all the muscle, which restricts even more of those good things getting to it. So now we just have this balled up muscle mass where the nerve on the inside isn't getting what it wants, so it's just sending out painful signals until it gets what it wants. So turns out in many cases, pain is the answer to decrease pain. By pushing on that area and holding it, you're going to tell the brain, hey, we got a problem here, send in blood. Blood will get to that nerve will unwind, the muscle around it will unknot, and in about 1 to 2 minutes, you'll find it just relax. Now, that's not going to be the cure-all. It might guard up again, it might take longer than 2 minutes, so this is something you can go back to, but either way, it's a good starting point. Best way that I found to do it, again with this lacrosse ball, finding a corner, something that you can push against, digging your upper trap or wherever it might be painful into it, and just holding. In the PT clinic, a lot of times I'll actually be able to push down into it with my thumb. That's how a lot of PTs end up getting a lot of arthritis in their thumb joints, so I'm glad to not be doing that on the regular anymore. But a lacrosse ball does a very good job at just finding the knot, pushing and holding, and only applying enough pressure that, again, you feel it without it being too painful, without it causing it to light up, because we want to take 2 steps forward, we don't want to take 1 step back all the time. So that's our upper back knot release. We also have our mid back knot release, where again, you find a wall, you find where that trigger point might be, and you just press and hold 1 to 2 minutes. If you're not finding any knots and it's just a general soreness, go ahead and just move around and let that become your massage tool. But if you're moving around, you're not holding long enough for, again, that whole process to go through of the brain sending blood allowing the nerve to relax. So find the painful point and hold it there. Don't move around too much if there is an actual trigger point. Final release is going to be your pectorals. Again, I talk about poor posture involving tight pectorals. Well, this is a good way to release the pectorals. Just on the inside of your shoulder bone, and this one I usually do a lot more movement because there tends to not be just a trigger point there. It's more just general muscle tightness. So moving the ball around, letting that open up. So step 1, active range of motion. Step 2, muscle release. Step 3, mobility. So let's walk through that. As I mentioned, you just need some floor space for this next movement. I talked about the mid-back release with the lacrosse ball. You can use the wall. You might find it's easier to relax if you're using the floor. So that's an easy option, whether it's in your upper trap, levator scap area, or closer down into your mid-trap rhomboid area. Again, you can move around to release the muscle, or you can just hold on that trigger point. Do this for a couple minutes, up to 5 minutes if needed. It's again, we don't want to light things up, but we do want enough time that the blood flow gets there. The next thing is your foam roller. A great option for mobility, where you can just line it up along your scapula, support your head, and allow yourself to just get that opposite curvature as what your forward posture, office working, driving posture has been promoting. So let's get that thoracic spine extended instead of crouched forward. This is also releasing the muscles while getting mobility of the back. Now, once you feel like you've gotten a good range of that, the next thing I'll use this foam roller for, which is just passive, is thoracic mobility. I'll take my knee, put it on top of the foam roller just to keep my hips stacked so I know that I'm not twisting my hips, because the only thing I want twisting is my thoracic spine. Now, bring your knee directly across from your hip, so 90-degree angle of the hip, head supported by a pillow if you have it, and start by just opening up, reaching to the opposite side. Again, this is active range of motion, so you're just allowing full range of motion, not pushing in anything that's too uncomfortable, holding long enough that you feel like it is getting its entire range, and repeating about 10 times. The next movement is going to be actually tracing the floor. So hand comes along, rotates back, continues to stay in contact with the floor, and again, your hips are staying stacked the whole time. Do this to both sides because we do want symmetry on that. Then we have a couple more mobility exercises for the thoracic spine. So with your hands directly under your shoulders, knees directly under your hips. You've got your standard cat-cow, which means arching your spine, moving your head down to create that curve, bringing your head up and pushing your thoracic spine down towards the floor and looking up towards the ceiling. Leads and head leads. Again, finding that range of motion that you feel is your limit, holding it long enough that you do get to the end and then you move back. So it's just an active range. You're not passively holding anything. The next movement for the thoracic spine, same position of the hands and knees, but this time lift up one hand. It's called thread the needle. You're going to reach through, keeping your eyes on your hand the whole time. And then you're going to pull back, rotating up, eyes on your hand, up to the ceiling as far back as you can. Reach through. And then a continued variation of this after you've done a few repetitions is now hand on the back of your head, leaning in, elbow touches your inside of the wrist. And then as you rotate up, again, looking towards your elbow, I want you to sit back onto your heels. Off your heels, coming forward, elbow touches wrist, sitting back towards your heels, rotating up, eyes on your elbow. Again, do this to both sides, but that mobility will start to really open up any inflexibility that's causing this muscle to tense up. Okay, now let's move into passive stretching. So we've allowed for active to get us some range and get blood flow. Mobility and our muscle release techniques have allowed for even more blood flow and more movement of those muscles. So now that we can stretch them into a fuller range, they'll respond, and more importantly, we'll get the most range from it and promote better flexibility in the future. So as a reminder, 2 minutes total of the stretch. Break it into however many components you want, 4 sets of 30 seconds, 8 sets of 15 seconds. I usually opt for a little bit longer because as you hold the stretch, you'll find it gets relaxed and you can go even further, deeper into the stretch. So let's talk about the 3 main stretches we're going to do and the variations. Stretch number 1, pectorals. Tight pectorals influence poor posture. Your head follows, your thoracic spine follows. So we need to loosen up these and stretch these so we can get into a proper posture. Easiest way to do that is with some sort of wall or corner, and your 2 pectorals are what we're going to focus on. Pectoral minor, pectoral major. To stretch the pectoral minor, we want your elbow higher than where your shoulder is. And before you start stretching, remember to relax your shoulder. So if I was on a corner right now, my arm would be on the other side of the wall and I would prepare to lean forward away from that wall. Maybe stagger your stance and slowly start to lean forward until you get a stretch in the front of the shoulder. If you're feeling any pain in the shoulder socket, it probably means you're too guarded in the shoulder. You need to back away, relax your shoulder a little bit more, or maybe you're just not ready for this stretch and you need to do just the initial things we talked about. But if it's feeling like a strong but tolerable stretch in the muscle region, please carry on. Start to lean forward, maybe even twist and rotate away until again you're feeling stretching in your front of the shoulder. That's pec minor. That's the most influence on poor posture, but pec major will still influence, and the best way to stretch that is either a similar hand position, this time elbow lower than your shoulder, but on that corner, same process, or my preferred method, hand more outstretched, and again, elbow lower than your shoulder, rotating away and leaning forward. Ultimately looking for a strong but tolerable stretch. The next stretch is actually going to be on the back. This is probably where you're feeling most of the tension, but that doesn't mean this is the most important stretch because the muscles pulling away from it are actually causing more problems. But you'll find that this is comfortable. Now, if you have a wall or something you can hold on to, it could be a table leg. Either way, you're going to hold. Step 1, start to lean back enough that you feel tension in the shoulder. Step 2, start to arch your spine, so you start to feel a little bit more pull into the back, maybe the lat region. And step 3, just like that thread the needle, you're going to start to rotate and look through your armpit. As you do this, you'll feel a stretch closer and closer to your spine and likely where you've been feeling a lot of the tension. Now, as you change up your hand position, whether it's higher up or lower down, that'll influence which area of your back you're going to get most of the stretch. Play around with it. Again, always do both sides for symmetry. Okay, and finally, neck stretches. You've got 2 main groups, upper trapezius and levator scap. Both are probably influencing this tension, but it's likely only one of them is your predominant pain source. So figure out which one it is, do more of that, but remember to do both versions. So version number 1, levator scap. You always want to start by making sure your involved shoulder, so wherever the neck tension is, that side stays down. If you have a chair, I would recommend sitting down and holding the bottom of the chair. If you have something to hold on to while you're standing, that's fine too. Or if you don't have anything, just place your hand behind your back. That'll help influence it to stay down. Step 2, rotate your head away from the side you're going to stretch. So your chin is getting closer to that opposite armpit. Step 3, use your other hand, grabbing the back of your skull and pulling forward and away, looking towards that opposite armpit the whole time. Now again, with stretching, the longer you hold it, the more you'll find it relaxes, and therefore the further you can go. Just take deep breaths, hold the stretch, and again, 2 minutes is your ultimate goal. If you need breaks, that's fine. Just make sure you're getting 2 minutes total after you put all the repetitions together. Now these stretches can be a lot, so without just immediately coming out of it, I recommend putting a little bit of resistance into your hand as you pull back up so there's no pain coming out. Next, let's go into the upper trap set. Same ultimate direction. The only change is that your chin is on the opposite side. So again, step 1, shoulder stays down, either grabbing onto something or placing your hand behind your back. Step 2, rotate chin towards the involved armpit. Step 3, hand pulls away and forward until you get that strong but tolerable stretch. Breathing as you relax and are able to get more. And again, slowly coming out of it, applying a little resistance to your hand as you pull back upright. So, just 3 muscle groups to stretch. Make sure you're stretching long enough, make sure it's strong but tolerable, and do it a few times throughout the day just to promote good posture. So now that we've got the muscle flexibility to hold back into a relaxed, comfortable posture, now we just need the strength to hold it there. Possibly one of the reasons that you're in this position to begin with is because your imbalance of muscle strength has been too weak and muscle tension has been too tight. Like I said, we've corrected the tightness, now we need to correct the weakness. 2 main exercises that I'm convinced will do everything for you. Step 1, wall angels. If you've got a wall, go ahead and lean your low back up against it, put your head up against the wall, bend your knees slightly so you're almost in a crouched position. This will just help influence the low back, upper back, and head all staying flush to the wall. And now you're going to move the back of your forearms against the wall until you're in this, call it a wall angel position. From here, you're going to slide your forearms up the wall, keeping your elbows in contact the whole time, keeping your chin retracted the whole time, as far as you can without compromising form, and then slide back down as far as you can without compromising form. Again, elbows and wrists are in contact the whole time, head, upper back, low back in contact the whole time. And with that repeated range, you're going to find that these mid-back muscles are forcing your scapula to stay exactly where it needs to be. Doesn't require any weights, doesn't require any resistance bands. It just requires those muscles that should be doing their job and usually aren't. So, easy enough, 10 repetitions, do 3 sets of that. And then, if you've got a resistance band of some sort, this one becomes my favorite. I call it the bow and arrow, where you've got one hand, and you're going to do this on both sides, so it doesn't matter which one you start with, but you've got one hand where your thumb is up, So usually I'll place this resistance between the webbing of the thumb and forefinger. The other arm is going to pull back like you would a bow and arrow. And just like when you're in archery, you need to relax your shoulders, pinch your shoulder blades together, keep your opposite elbow kind of down and relaxed. And then as you pinch your shoulder blades even more together, pull your elbow even more back, keeping your shoulders down, you're going to find that it targets this lower trapezius muscle perfectly. Again, a lot of the problem is upper trap is too tight, lower trap is too weak. This will counterbalance that. So again, thumb up to the ceiling, opposite hand can also be thumb up to the ceiling, and you're just going to pinch the shoulder blades together, pulling this elbow down behind you. So you should be feeling it right here underneath your shoulder blades. Again, 10 repetitions, 3 sets. You could do this a couple times a day. It's really just influencing those muscles. The resistance doesn't need to be anything too aggressive. It's mostly just to influence that muscle from firing. So that honestly is it. I know that seems like a lot. Normally I try to keep it more simple. We're talking like 3 or 5 exercises. This one happens to be a lot more. Each component is simple in its own nature, but you need all of them. You need active range of motion to open up. You need mobility and muscle release to allow those muscles to not stay so guarded. And you need flexibility and strength to promote continued natural posture. But by just incorporating these throughout the day, by avoiding the ones that are painful, we're talking anything greater than a 4 out of 10 on the pain scale, 0 being none, 10 being hot lava, the worst imaginable pain that you could experience. If you just do those throughout the day and continue to remind yourself, shoulders back and down, head back, chin tucked slightly, you're gonna find that naturally those muscles that are causing you problems are gonna get the blood flow they need. They're gonna get the oxygen and chemical mediators that will allow them to relax and feel comfortable again. And in the future, as long as you keep influencing it with these semi-regularly, it won't come back. So thanks for tuning in. Let me know if you have any questions in the comment thread, but other than that, keep optimizing, and thanks for tuning in.